Inflammatory breast cancer is a rare and aggressive form of breast cancer that often strikes women at a younger age, is particularly deadly, and does not always present with a lump. Because the signs of IBC mimic those of mastitis or cellulitis, clinicians often misdiagnose IBC, which delays treatment for weeks and sometimes months. I selected an article that analyzes the delay in diagnosis for IBC patients in relation to the survival outcome. This issue is important because if IBC can be diagnosed earlier, survival may be increased. The study I reviewed included 155 patients with IBC. They were given chemotherapy and their clinical response to chemotherapy was measured, either complete, partial, or no response. Researchers also measured the time interval from the initial symptoms at first clinical assessment to the actual IBC diagnosis. The researchers found that the patient response to chemotherapy was a dominant predicting factor in determining patient outcomes and not the time delay from symptoms to diagnosis. The implications of this study are that misdiagnosis many patients initially experience, which often delays accurate diagnosis, and thus treatment does not affect the outcome for patients as much as does the clinical response to chemotherapy. Further research needs to be done to differentiate whether delayed diagnosis might result in a greater tumor load and thus poor response to chemotherapy. Therefore, based on this critique, my argument remains that breast cancer education needs to be focused towards clinicians and patients to identify IB symptoms at onset, particularly promoting the fact that you don't have to have a lump to have breast cancer.